Marie and Matt, congratulations.
Congratulations.
Well, I can tell you that I'm so glad to see this outcome. This patient is really extremely high risk. And I think the key to success is that because the multidisciplinary care. And I can speak enough that my OB team, including the Dr. Brennan and Dr. Santana, and also my senior residents, Dr. Lenz, and also including the Dr. Donamari and the anesthesiologist, the Nancy Schreiber cannot be here today, and the NICU, the Dr. Boxer, and also the nurses. And when we saw Mrs. Anne-Marie Barato, and we immediately saying that this is the case that we need to bring the whole team together. And this is usually we do here. So when I saw this patient, and I immediately tell them that the first thing is that try to call the cardiology, and Dr. Donamari try to work it out this patient. And hypertropic cardiomyopathy in pregnancy is extremely high risk. And the pregnancy in general is that can good or bad. The good is because you increase the plasma volume about 50%, and this kind of a disease that you need to maintain adequate the fluid volume. However, the pregnancy, because anxiety and sometimes the exercise, change position, and that kind of thing can worsen the condition. So it's kind of when you don't have a meticulous skill and knowledge to manage this patient, the mortality is quite high. So after we know that, then we talk to Dr. Donamari, and then end up the patient, kind of arrange from the clinic and to the admission. And at that time, she developed the symptom, and she started feel shortness of breath, and also have some dyspnea. And at that time, is that we decide to deliver her. But when we decide to deliver her, at that time, it's the one difficulty is that, what kind of anesthesiology, what kind of anesthesia you need to give to the patient. And the other thing is that you have to be careful not lose a lot of blood, because that can worsen the patient condition. And I was so respect Dr. Donamari stay in the whole C-section process, and end up is that Dr. Santana did the surgery, and the blood loss only 1,000 cc. That is pretty average, the blood loss in the C-section. So patients after the delivery in the recovery room, and our two nurses, the Betty Jo and the Doreen, they really spend the whole time and take care of the patient. And because the postpartum is very important, once patient, anxiety and pain that you need to take care of. And patient has to stay in the recovery room and uneventful. And after that, and she was transferred to the postpartum, and we have the Sunavari, it's our nurse manager at postpartum unit, and we really spend a lot of time and watch the patient, and certainly Dr. Donamari and me try to follow up, every minute and make sure that she's okay. Before I give it to Dr. Donamari, and I would like to say is that the NUMC, we always build up this kind of a multidisciplinary team care, and the reason is that we trust each other, we respect each other, and then that's why we come together and give a patient confidence. And again, congratulations, Anne-Marie.